is Ayman Hammoudeh. I'm an interventional cardiologist in Amman, and I'm the president of the Jordan Collaborating Cardiology Group, JCC, in Amman. I'd like to welcome you to the second Interventional Cardiovascular Club, and I will give you an idea about the JCC group projects in cardiovascular disease and epidemiology in Jordan. Our group has been active in performing so many clinical registries and studies that look at cardiovascular disease epidemiology in Jordan. The Middle East has been underrepresented in so many clinical trials in this era where cardiovascular disease claims more lives, and it is the leading cause of death all over the world, including the Middle East. And Jordan is no exception to that rule. So 15 years ago, we performed the Joe Hart's study. Joe Hart looked at 5,000 individuals, and we looked at the risk factors in 5,000 Jordanians. And we found that most of the Jordanians with coronary artery disease, i.e. 95% of them, had at least one of the 4 classical risk factors: diabetes, hypertension, dyslipidemia, and smoking. And this study was published in the International Journal of Cardiology and was presented in the European Society of Cardiology meeting many years ago. The second study that we did was CAPRIS. CAPRIS looked at the prognostic effect of HSCRP in acute coronary syndrome. And we found that if a Jordanian is admitted with acute coronary syndrome and has a high level of high sensitive CRP, this high level predicts higher rate of mortality at 1 year. Again, this was published in the International Journal of Atherosclerosis. The third study, which was MENTOR. MENTOR looked at 1,000 ST elevation myocardial infarction patients, and we evaluated the triggers of MI in Jordan. And we found that about half of Jordanians who sustained MI, half of them, 46%, they have either psychological or physical stress, like anger or stress or emotional problem or financial problem. We also looked at the onset of MI, and we found that Friday is the commonest day of occurrence of myocardial infarction in Jordan. The fourth study was GLORY. GLORY looked at the incidence of glucometabolic states in Jordan, because some of the patients are not only diabetics by history, which is around 50%, but we found that an extra 25% when are admitted with acute coronary syndrome, they have elevated glucose without having a history of diabetes. And what we found that 75% of Jordanians with acute coronary syndrome have new onset diabetes or all diabetes. And strangely enough, those who have diabetes during the admission rather than past history had the highest mortality. The final study was Joe PCR, which looked at the outcome after PCI in Jordanians and Arabs. We had about 2,500 Jordanians. This study was presented in the EuroPCR. We evaluated stent thrombosis, was also presented at the Asia Pacific Conference in Abu Dhabi and looked at the bleeding, was also presented at CardioAlex in Alexandria in June, and it looked at same-day stay. We evaluated the study also. We looked at the mortality in London at ESC. And finally, last week, we presented data on obesity at the American Heart Association in Orlando. We have data coming in Florence in Italy, in Dubai, and hopefully we have Istanbul and the New Mexico World Congress of Cardiology. We are proud to present all of this data in the name of the Jordan Cardiac Community and Jordan Cardiac Society, and also at the same time to gather cardiologists around a format of cases. We are organizing this Interventional Cardiovascular Club, and we welcome you to the second club. Today we have a group of interesting cases, and hopefully you will enjoy them. Thank you very much, and see you again. This is Ayman Hammoudeh. Have a good day.